my name is Nikki. I'm a third-year nursing student, and today I'm going to be demonstrating how to administer a drug through a CIVA pump. So the drug that I have today is methylprednisolone. So I'm going to start from my hand.
That it's hitting higher. So
And I'm going to be removing my drug,
using after it's done.
my methylprednisolone, from my Pegasus machine, and then comparing it to my MAR to do my first med check. So I have the right patient, Mr. Sam Smith. I have methylprednisolone, so the right drug. The right route, it's IV every 6 hours. The right dose, 100 milligrams, and I have a 125 milligram vial. And the right time, it's about 9 o'clock in the morning. Okay, so I'm just going to be comparing my drug to my monograph just to make sure that it is safe for me, that I can administer it, and that to see what I need to reconstitute my drug.
That wasn't bad. That was
so I have methylprednisolone. Right? It is a steroid.
I still
so this drug, my patient is getting this drug because he does have arthritis, so it's going to help because it is an anti-inflammatory. So I'm just checking to see if I'm allowed to administer it, so a student nurse can administer this drug. And I'm just going to be looking to see the safe dose, so the dose that my patient has is within the safe range. So I'm going to be looking to see what I need to reconstitute my drug in. For a 125 milligram vial, I need to reconstitute it within 2 mLs of sterile water, and that's going to give me a final concentration of 62.5 milligrams per ml. So I'm just going to grab my sterile water, and I'm going to be alcohol swabbing it for 30 seconds, letting it dry for 10. And then I'll let that dry for 10. Then I'm going to be taking a 3 ml syringe to draw up my 2 mLs.
That was not bad. I just hate when
So I'm going to put about 2 mLs of air into my syringe. This is just going to help with the pressure when I draw up the sterile water. So I'm going to be injecting that. And drawing up the 2 mLs.
Alright, there we go. Alright, John. Your elbow's right beside you. Make sure you call me.
Making sure that there's no air bubbles. And I'm going to be recapping it for sterility.
Okay.
Oh no, wait. No, that's yours.
Okay, so I have my 2 mLs of sterile water. So now I'm going to be reconstituting that into my drug. So I'm going to alcohol swab my methylprednisolone.
Patience, the drug.
Again, another 30 seconds, letting it dry for 10.
And I would indicate if there was any signs of redness.
I'm going to be injecting the sterile water.
I just hate when you're going and then you just blank. You know what I mean?
And then I'm going to roll the vial between the palms of my hands. I'm not going to shake it, just because that's going to create air bubbles. And I'm just rolling it to make sure that all the particles do dissolve and that there's no particles that are left in it. Okay, so that looks good. So now I'm going to be doing my second med check. So I'm going to be, again, checking the methylprednisolone against the MAR. It's for the right patient, Mr. Sam Smith. The right dose, 100 milligrams IV every 6 hours. And the right time is 10 o'clock. I can also check the expiry date on my vial as well, and that looks good. And I'm also going to check to make sure that my patient has no allergies to this medication. He has no known allergies. Okay, so now I'm going to flip to my CIVA. So now I'm just looking for methylprednisolone. It says that for a 40 to 250 milligram vial, you can have 10 mLs in a 10 ml syringe, and you're going to be setting it to a normal rate, which is going to take about 26 minutes for it to infuse. So I know that I need to now further dilute it with sodium chloride, but before I do that, I need to draw up the amount of medication that I'm going to be giving to my patient. So again, my patient is getting 100 milligrams, and it comes in a 125 milligram vial, and then I'm going to times that by 2, so I'm going to be drawing up a 1.6 ml. So I'm going to, again, alcohol swab my methylprednisolone for 9 seconds, letting it dry for 10. Taking about 1.6 mLs of air. I'm going to be injecting that into my vial. And then I'm going to be withdrawing the 1.6 ml of medication.
Yeah. I think I always do that right.
Perfect. So I have the 1.6 ml. So again, I'm going to be recapping it for sterility. And I'm going to... Okay. So now, which I mentioned from before, I need it to be in a 10 ml syringe with 10 ml. So I have 1.6 that's drawn up, so I now need 8.4 mLs of normal saline. So I'm going to take my normal saline, I'm going to alcohol swab the top of it, and I'm going to be drawing up the 8.4 in my 10 ml syringe.
I'm going to demonstrate how to,
So again, 30 seconds, letting it dry for 10.
my name is Megan, and I'm going to demonstrate how to reconstitute the medication.
So I'm going to put about 8.4 mils
Administer it via the CIVA. So I've already taken my medication.
of air and injecting that.
And I'm going to be administering methylprednisolone today. So I'm just going to do my first medication check here against the MAR. So I'm just going to make sure I have the right piece in it.
Like the actual eye putting it.
Maybe looking for any air bubbles. And again, recapping it,
Medication and administering
maintaining that sterility.
So I've already taken my medication from the pharmacist, and I'm going
So now I know that I need to put my 1.6 mLs of medication into this 10 ml syringe. So before I release the blunt needle, just to make sure I don't lose any of this, I'm going to be drawing it on my syringe for about 10 mLs. Releasing my needle. Then I'm going to be injecting my medication. I'll be recapping this for now, but I would be disposing this needle into a biohazard. So now I'm just going to put a cap on the end of my syringe, again maintaining that sterility. I'm making sure that there's no air bubbles. So now I'm going to be writing up the drug label. So I'm just going to be writing the name of my drug, the dose, which is 100 milligrams, the volume in 10 mLs, the concentration per ml, which again is the 62.5 milligrams per ml. I'm going to date it and initial it. I'm going to be attaching this to my syringe. Okay, so now this is ready to go to the bedside. So I'm just going to prime my line. Just to make it a little bit easier, I'll prime my line before I go to the bedside.
My name is Megan, and I'm going to demonstrate how
So I'm just going to look for the, to make sure that there's no holes or anything in my line. And I'll be attaching my
My
syringe.
name is Megan, and I'm going to demonstrate how to reconstitute the medication. Hey, stop laughing! Stop!
You said you're being weird.
Why?
You said it weird.
Just prime the line.
Okay.
Perfect. So that's ready to go. I'm going to put a label on my tubing as well.
Sorry.
Just putting a label on my tubing so then the next nurse will know when that tubing was there so that she knows when to change it. So I'm just going to be writing my name and the date and the time.
Hi, my name is Megan.
And then this can attach directly to it.
I'm going to demonstrate how to reconstitute a medication and dilute it and administer it via and CIVA.
So I'm ready to go. I'll bring my syringe and my line that's already primed with some alcohol. And then I'm also going to bring my MAR into the bedside to do my third med check at the bedside. I'll just perform hand hygiene before I go into my patient's room.
Dose, the right route, and the right time.
Okay, and then we're ready to go to the patient's room.
So,
entering the room, I'm just going to make sure that I do a med check, a safety check, making sure that the bed is as low as it can be, and making sure that everything is good.
and also look at the maximum single dose to make sure it's within the safe range.
Hi, Mr. Smith. My name is Nikki. I'm going to be your student nurse today. So today I'm going to be administering your methylprednisolone. This is going to be for your arthritis, so it's going to help with some of the pain. Just some of the quick side effects, though, is that you may be experiencing nausea, vomiting, or an increased heart rate, so it's very important to report any of those. It also is a corticosteroid, so it may lower your immune system a little bit. So any visitors that maybe are sick at the moment, maybe if they can, they should be refraining maybe just for the time being to come in and visit, just because you are a little bit at a high risk of developing infection on this medication.
Let it dry for 10
So I'm just going to check your armband. So making sure that I have the right patient. I'm going to ask him for 2 identifiers, so for him to state his name and his date of birth. And again, just checking for any allergies once again. So I'm also going to be checking for the patency of the IV that is currently infusing into him. I'm going to be checking the site itself, just making sure that there's no like phlebitis or infiltration, redness, tenderness, anything like that. And it does look good. So at the bedside, I'm going to now do my third med check. So again, I'm just going to take my medication. I'm going to be looking. So I have methylprednisolone. It's for Mr. Sam Smith. It's 100 milligrams IV every 6 hours, and it's going to be, and it's 9 o'clock.
and I'm going to withdraw 1 milliliter of air, inject it in stale water, and then drop 1 milliliter.
So I'm just going to be attaching this into the CIVA.
Hey, you call me?
There's no bubbles there, so that's good. I'll inject it into another. Okay, so just recap that for now. And I'm just going to roll the medication in my hand because shaking the medication would introduce bubbles into the vial, which would make it harder.
I'm going to alcohol swab the port that I'm going to be attaching it to.
And then I didn't really pursue the relationship.
Again, just to maintain that sterility.
Okay, so now I just need to figure out how much I need to draw up.
So 30
for
seconds,
60
let it dry for
milligrams, I know that I need to draw up 1.5
I'm going to make sure
milligrams
that
in
this
total.
remains sterile.
So I'm going to pull back 1 milliliter of air. And I know that these are still sterile. I haven't touched the top of it or anything. So I don't need to swab it again.
Perfect. And the instructions in the CIVA said that this med is going to be infused. It's going to take about 26 minutes, and we can see here that it will take about 26 minutes. It's going to be set at a normal rate, so we'll press normal for that. So now I'm going to just remain with my patient for several minutes, just making sure that he doesn't get any side effects, and that to just watch the patency of the IV. Also, in about 25 minutes, I would be coming back to the room to monitor my patient and change the syringe out for normal saline. Normal saline is just going to help to get the patency of that tubing going so that it's ready to go for the next nurse that's going to be administering another medication. And then lastly, I'm going to sign off on my MAR. So on my MAR, I'm just going to be writing the date and the time that I gave the medication, and I'm going to initial it, and also I'm going to write in an IPN how well my patient tolerated it, any documentation, so how well they tolerated it, if they got any side effects,
So I know I have the right patient.
etc.
Mr. Smith, I have the right drug.
Also, my patient will know that he does have the right to refuse this drug as well.
IV and the right
And other than that, I believe that's it.